Dr. Hasan, thank you so much for joining us from New York. This is actually the first IMG, I guess, advice interview that we're going to be conducting for our event. So thank you so much for joining us. What we want to ask you first is if you could tell us a little bit about the psychiatry department in a major city hospital.
Well, first of all, thank you for allowing me to participate in your project to encourage the medical students from Middle East to pursue their career in the United States. The psychiatry in major metropolitan cities in United States probably is quite different than psychiatry from a smaller town or psychiatry from even other countries. Psychiatry is a very vibrant, very lively, very busy, quite structured, quite busy subject in any major metropolitan hospital, whether it is run by the city or by the state or by even federal government such as VA hospital. So you see, the field of psychiatry in major metropolitan areas, particularly New York and Philadelphia and Boston and Miami and LA, inner city Chicago, would be very different than practicing psychiatry maybe in Alabama and smaller towns of Ohio or Wyoming and North Dakota. So you could imagine, that in New York, out of 14 health and hospital corporation run hospitals, there is a separate entity in psychiatry called CPEP, Comprehensive Psychiatric Emergency Program. At least 7-8 hospitals have Comprehensive Psychiatric Emergency Program, which is independent psychiatric emergency room only. So you can imagine how busy it could get in an inner city metropolitan hospital.
Okay, so what is your impression of the international medical graduates that you work with in the department? Obviously, it's quite a diverse hospital that you work in, being that's in New York City. So can you just give us a brief idea of working with them?
Well, inner city major metropolitan hospital are literally addressing the emotional needs or psychiatric need or psychosocial need of people from all over the world. So you see, we are quite diverse. Our hospital is one of the most diverse hospital perhaps in the world. Queens, Jackson Heights, Elmhurst area, Astoria area is probably the diverse place on earth. At any given moment, you can get a patient from El Salvador. The next patient could come in from, say, Tanzania, or the following patient could come from Cyprus, or Greece, or Syria, or Lebanon, or Bangladesh, or China. So, as you can imagine, we like to attract people from all over the world. Particularly, we like to attract residents from all over the world too, to address the needs of this patient. So my impression about IMG is very positive, and it would be very, very difficult to run the whole healthcare delivery system in any major city like New York without the participation of the IMGs. So I'm very happy about them. We are very proud of them, and we look at them quite positively.
So you're also saying that it's not just New York, basically. The IMGs are getting hired throughout the country.
Throughout the country. However, the chance of getting into residency is perhaps higher in major metropolitan hospitals such as New York or Philadelphia and inner city Chicago and Miami and LA and San Francisco, all major metropolitan hospitals because of the diversity at large.
Okay, okay. So, in your opinion, doctor, what should an international medical graduate know about psychiatry as opposed to internal medicine and general surgery as a residency option for them?
Well, I mean, I think that compared to United States, medical students from other parts of the world might not be as exposed from, say, if medical students from Asian countries or Middle Eastern countries or Latino countries, their rotation in psychiatry might not be as advanced as the rotation of the local medical graduates or even the Caribbean medical graduates. So our medical students from our local medical colleges, they are perhaps very much aware of the subject of psychiatry and their likings and dislikings and so on. Given that the IMGs are not very exposed to, say, consultation liaison psychiatry or psychiatric emergency program and outpatient psychiatry and forensic psychiatry and general adult inpatient psychiatry and child psychiatry and adolescent psychiatry and geriatric psychiatry, we have so many subdivisions in psychiatry nowadays that if they were exposed to all the fields of psychiatry and subdivisions of psychiatry, perhaps they would be more interested. Perhaps they might not like, say, geriatric psychiatry, they might like child and adolescent psychiatry. So I'm not sure really how much the IMGs are exposed during the rotation in the 4th year and the 5th year in all the sub and subdivisions of psychiatry. So therefore, they might not show some interest in psychiatry. So had they been exposed, perhaps they would like it even more and they would consider psychiatry as a career in the future. Having said that, also it is very important to know that, say for example, somebody who likes medicine perhaps equally like pediatrics. Somebody who likes trauma surgery very easily and equally might like ED, which is emergency department, or ER, try to become an ER physician. So it could be, as you say, mutually inclusive to some extent. However, if you don't like psychiatry as a field, you might not have a parallel field going on that you might be interested in. If you like psychiatry, it might need to invest some time to figure it out, how much do you like psychiatry or not. So therefore, sometimes we find people who try to join psychiatry, but they're not as interested in as they thought they would be. And also, I would request the IMGs not to apply in psychiatry if they are not really interested in psychiatry, because during the interview, the faculty members can very easily figure this out, that who is particularly interested in psychiatry or not.
Okay, so doctor, what you were saying actually, that obviously IMGs are not going to be as exposed or have as many, let's say, opportunities to have their rotations in psychiatry as much as, let's say, the Caribbean medical graduates and American medical graduates.
Right.
How do you fix that? What should let's say a medical student from the UAE, let's say, since the event is here, if they do have an initial interest in psychiatry, but they obviously want to explore this more, what would you suggest to them?
I would definitely suggest them to talk to their dean or talk to their supervisor or talk to their professors to allow them to be exposed to psychiatry, probably not only 4 weeks, maybe several months if it is possible, and also if they have initial interest in psychiatry, I would suggest them to do an elective, and I would request them to pursue perhaps outside if there is an exchange program, or even try to do voluntary work after their medical school to find out whether they're really interested in psychiatry, and so on, because it is a very exciting field to be in.
Okay. Now, about the residency application in general, what is a common error that you believe that foreign medical graduates are making on their applications? Obviously, you're a little involved in hiring the residents for each year. So what is a mistake that you believe residents might be making they could avoid?
A lot of times, foreign medical graduates try to, or IMGs, international medical graduates, try to apply in too many fields. Say internal medicine, pediatrics, psychiatry, family practice, particularly these four, and also OBGYN. So a lot of times it needs to be customized. Say, for example, if you are particularly interested in psychiatry, you cannot get a recommendation letter from, say, radiology that, okay, I have seen these or I supervise these medical students during their 5th year of medical school, and this person is interested in psychiatry. That would be really the biggest mistake. And you need to really customize your application. If you're interested in psychiatry, you need to expose yourself to this field much longer period of time and get the recommendations letter written by perhaps the head of the Department of Psychiatry, or at least the professors of behavioral medicine or psychiatry at large, or a psychologist, a clinical social worker, and so on and so forth. And also, you need to make sure the score is much better in psychiatry, and so on. And also remember that I'm not sure how much behavioral science or behavioral medicine at large is taught in many international medical schools, because the first part and the second part, at least 30% questions are come from behavioral medicine and psychiatry, both in first part and second part, and so on. So it is very important that if you're interested in psychiatry, try to do well in both part 1 and part 2, and so on. So with this course, we can also kind of try to figure it out, that how strongly they want to be a psychiatrist, and so on. And of course, during the interview, a generic statement like, okay, since in early childhood I want to be a psychiatrist, that sort of interviewing style and the process is probably not the right thing to do. And I think it is possible to make you very personal, very structured, and very unique stories why you want to be a psychiatrist. And be honest. Definitely those are the things very important, and it helps.
Okay. So another question that obviously a lot of international medical graduates have is that sometimes they feel as if they are at a disadvantage, just generally, compared to the American medical graduates. So what are some advantages that foreign medical graduates may have that they may not realize that American medical graduates do not have?
I think it's a misconception. The foreign medical graduates, perhaps they have a little bit of disadvantage given their immigration status and so on and so forth. But otherwise, currently the structure of the exams are such that you don't need to take separate exam than the local medical graduates. So there used to be that the foreign medical graduates had to take a different exam than the local medical graduates, but that was plenty years ago. However, the IMGs definitely bring something very extra and very unique to the table. Their own cultural background, their own experience, their uniqueness, how they grew up in a different culture, and how they dealt with other people. What are the things they have done and seen. Those are very, very unique, and we value those things quite a lot. So therefore, I don't think the foreign medical graduates have anything to be worried about. I think they are rather in a very strong position to apply for residency, whatever they like to do in this country. United States always had an open arm about international medical graduates. Lot of foreign medical graduates work in the United States successfully, and there are a lot of international medical graduates are currently professors and program directors and faculty members throughout the United States. Some of the foreign medical graduates are chairmen of the department in some major universities even. So I don't think there is anything to be afraid of. I think if you try harder, make a good score, get some good solid recommendation letters, you'll be just fine.
So you're saying that it's kind of a misconception, the idea that a foreign medical graduate, they shouldn't feel like they're a lost cause. It's a lost cause to apply to the States.
No question about this. Foreign medical graduates always get into residency every single year in the United States. Now, you have to remember that you need to pass those exams, you need to score very high, and even American graduates need to score very high, and so on and so forth. So you need to try to pass the exam in the first chance, and you need to finish all those exams as soon as possible. You cannot wait 3-4 years before you take that exam. So those are the things, very common things. That's very general. I mean, if an American graduate waited 4 or 5 years to take those final exam, we'd question them too, that what they have been doing after their graduation. So similarly, I think the faculty members and departments have pretty rational reason to ask the IMGs that what had you been doing after you graduated from medical school, and if they have a very credible evidence that they have been doing clinical work or research work and so on, I don't think that IMGs are anyway discriminated against, as long as they have they score good, they take the exam fast, and their English language capacities are pretty much safe and sound. I don't think they have anything to worry about.
That's fantastic. Final question, Dr. Hasan. Any wisdom that you want to impart specifically for the foreign medical graduates that are going to be applying in a few years? We have some 5th years with us. We have many 4th years. We have some interns actually who are completing their final, well, technically their final year in the UAE perhaps. So any advice just from you, just from your experience, from working with foreign medical graduates, anything you'd like to add?
Don't believe others until you try it yourself.
Okay.
Because there are a lot of gossips, a lot of whispers, a lot of noises about residency in this country versus that country, in Europe versus America, and here, and Australia, and there, in New Zealand, and South Africa. So it's a globalized world now. So until you try it yourself, don't believe others, what you hear. So keep your focus high, you can do it. This is a very open world now, and if you have it, you can prove it to yourself and prove it to others. Thank you and good luck.
All right, thank you so much.